Healthcare, one of the most contested issues in the country. According to the U.S. Census Bureau, there are currently 46.3 million uninsured Americans. A study in this month's American Journal of Public Health looked closely at how this statistic might affect mortality rates. ABC News Chief Medical Editor Dr. Tim Johnson has more.
Past research estimated that one American dies every 30 seconds from lack of health insurance. But even this grim figure is too small, according to new research from Harvard Medical School, which estimates that now one American dies every 12 minutes. Researchers looked at data from national surveys from the Centers for Disease Control and Prevention and assessed the likelihood of death among both uninsured and insured working-age adults. Even after controlling for education, income, baseline health, and many other factors, they found that uninsured Americans have a 40% higher risk of death than those who are privately insured. The study also estimated that 45,000 deaths a year are associated with lack of insurance, a figure that more than doubles the 18,000 annual deaths estimated by the Institute of Medicine in 2002. Researchers felt that the increasing number of Americans going without health insurance and the eroding state of health care for the disadvantaged are at the root of these growing mortality rates. With this Medical Minute, I'm Dr. Timothy Johnson.
And joining me now to discuss the study further is Dr. Jorge Rodriguez, an MD VIP primary care physician. Dr. Rodriguez, thank you for joining us today.
Oh, my pleasure.
We just heard there are nearly 45,000 annual deaths associated with a lack of health insurance, which means one American dies every 12 minutes because of not being insured. As a physician, does that surprise you?
Actually, it doesn't surprise me. I think what this study, which I think is a phenomenal study because it's statistically very sound, included tens of thousands or around 10,000 people for many years. And what it showed is, I think, what we doctors have always known, that access to health care guarantees long life. And it makes sense. If you're sick and you have a cold, if you don't go see the doctor, this cold could turn into a pneumonia. That pneumonia could turn into something deadly. So having access, this proves, does guarantee longevity and long life.
There is an undeniable logic to it, and you trust these numbers to be fairly accurate.
Oh, these numbers are statistically so sound. I think this is such a good study because, first of all, it had a huge number of people, which makes it statistically more valid. They then excluded other parameters that might have been influencing death. So when they said that 40% of people that don't have insurance have a higher incidence of death, they already considered gender, age, smoking, obesity, so that the only thing that was affecting the change was whether you had health insurance or not.
You know, these uninsured Americans found to have a 40% higher risk of death than their privately insured counterparts were working age Americans, young people. Does this mean that youth doesn't necessarily equal good health in this country?
Oh, that's absolutely right. And we can just start off by looking at how much, for example, juvenile and childhood obesity we have in this country. So just being young does not guarantee health because even young people come up with accidents, have broken limbs, and they need access to health care. So it is being able to treat a problem soon after it happens that appears to be directly correlated to how well you do.
So healthcare, what are your feelings about a public option? Do you think that that will help get these numbers down?
I personally think that the government should come up with a public option. We already have Medicare. Let the government compete with private enterprise. That's my feeling. But what this is basically saying is that somehow the 46 million Americans that don't have insurance need insurance. People with pre-existing conditions need insurance. For example, MD-VIP physicians, we have 60% less admission to hospitals, our patients do, because people have access. So personally, I say, let the government come up with an option and let's see, put it up the flagpole, let's see if anybody salutes.
Let the best man win, as you say.
That's what I say.
Right?
Yes.
All right, and another big problem you say that we're not really addressing is that less and less doctors are becoming primary care physicians. And you have a suggestion for how we can address this, is that right?
Well, sure. I mean, I say, you know what, we need less Dr. McDreamies and more Marcus Welbys. Actually, you need someone that will handle the colds, the flus. So I think, for example, that a lot of young kids are not going to med school because it's too expensive. So personally, I would like to see the government provide almost like a Peace Corps plan for kids that want to go to med school. That is to say, you go to med school for 4 years, your tuition is paid for by the government, then you pay the government back with either 4 to 6 years of medical service in the United States in underserved areas. Therefore, I think it's going to be a lot more likely for people to go to med school, not have that huge debt, and then we need and we get those doctors that we desperately need.
Sounds like a fantastic plan. Have you talked to Congress about it, Dr. Rodriguez?
Hopefully they'll be calling me
Yes.
today after they see this, exactly.
All right, and as you know, Senate Finance Committee Chairman Max Baucus recently released a 10-year, $856 billion health care proposal, which has been met with criticism from both sides of the debate. What do you think of his proposal? Should it be considered?
Well, I think it should be considered, but what I didn't really like about the proposal was that it put sort of the onus of having insurance on everyone in this country, which meant that if you don't have insurance, you could actually be fined. And the problem is that a lot of Americans nowadays can't afford insurance. I mean, this financial crisis has caused a lot of people that were on the verge of bankruptcy to actually go into bankruptcy, and then you can't afford insurance. So how can you find people that don't have the money to get health insurance? Which is why I think that perhaps a public option is one part of the whole solution. So that's my biggest contention with that.
Dr. Jorge Rodriguez, thank you so much for your insight on this issue.
My pleasure.
And for more information on this study and the healthcare debate, be sure to check out the health page at abcnews.com. We'll be right back.
ABC News Now. Good to know.